Here's the scan of the room. Here's wall number 1. Ceiling, wall number 2, surface. Here's wall number 2, 3, wall number 4, patient, wall number 5. Here is another surface. Here is another surface. Those are all the tools. Another surface. And here is the other surface. Here is the ceiling. It is only me and the patient present in the room. All right. We are at about 54 seconds. We can start the clock. My name is B Lynch. This is my head-to-toe video for University of Memphis FNP program. We will start by assessing the patient's skin, her face, neck, anterior and posterior, chest, and her abdomen, looking for any edema, scarring, bruising, nevi, any kind of abnormalities, tinting, elasticity. Now, assess her head, midline position. We're looking for head distribution, hair distribution, texture, color, any infestations. I'm going to palpate her head for any indentions or tenderness. I'm then going to palpate her temporal arteries for any tenderness. I'll move on to the lymph nodes of her head and her neck. We've got the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'll then I'll palpate TMJ for decrepitus, and that for cranial nerve 5, I'll ask the patient to clench her jaw. Good. And then I'll test cranial nerve 5 also by doing light touch sensation. If you will, close your eyes and then tell me where you feel me touching on your face.
Head, cheek, nose, chin.
Good. All right, and then I will ask, we will do cranial nerve 7 for facial symmetry. If you will, puff out your cheeks, pucker your lips, smile, frown, raise your eyebrows. Good. All right, now I'll move on to assess the patient's ears. I'm looking at the position of her ears. I'm palpating the tragus and the pinna for any masses or tenderness. I'm going to look at the auditory canal and tympanic membrane on both sides. I'm then going to assess cranial nerve 8, starting with the whisper test. So I will ask you to cover up your right ear and I will whisper in this ear. Tell me what you hear.
Apple.
Good.
Baseball.
Good, great. All right, and then we'll do the rubber test for lateralization. I'm going to place this on top of your head. Tell me if you hear it in the left ear, right ear, or in the middle.
Middle.
Good. Then we'll do the Rene test. This is for lateralization, air conduction over bone conduction. I'll place it behind your ear and next to your ear, and you can tell me which position you hear it most in, okay? Position A, position B.
B.
Good. Position A, position B.
B.
Good. All right. Then I will start to inspect the patient's eyes. I'm looking at her eyelashes, her eyebrows, her palpebral fissures. I'm going to look at her sclera, looking for any discharge or incrustations, any signs of infection or jaundice. I am also going to look for the red reflex using this slide here. Looking for red reflex and internal eye structures. Good. And then I will test for pupillary response, convalescent versus direct pupillary response. So convalescent being the pupil opposite of the one I'm shining the light in, it should restrict as well. Good. And then I'll test for convergence and accommodation. So if you'll look at my finger and then follow it as I move it into your face, closer to your face, just with your eyes. Good. I'll test for Cranial nerve 2, which is gross visual acuity and peripheral central vision. We would use a Snellen chart for gross visual acuity. So I've already tested hers with that, and she has 20/40 vision on both eyes. And so we'll do peripheral vision. If you will, tell me when you see my hands.
There. There.
Good. All right, now we will test for cranial nerve 3, 4, and 6. This is for conjugate gaze with extraocular movements. We're going to do 6 fields of vision if you just follow my finger with your eyes. Good. Okay. All right, so now we will, I'll go ahead and I'm going to palpate her maxillary and facial sinuses. Okay. Now I'm going to look at your nose. I'm looking for symmetry. So the face is straight. We'll test for nasal patency. If you will, cover one side, breathe in and out, and then cover your other side and breathe in and out. Good. Nasal patent. We will test for cranial nerve 1, which is sense of smell intact. So if you'll close your eyes, I'm going to put something in your nose. If you'll smell it, tell me what it is you smell.
Cinnamon.
Good. All right. Now I'm going to assess the patient's mouth and throat. So starting with her lips, and then I'll look inside her mouth, looking at her teeth and gums. If you look in your mouth for me, teeth, gums, pharynx, tonsils, I would grade if they were present under her tongue, buccal mucosal, soft palate. Then I'll ask her to say,
Ah.
and that is cranial nerve 9 and 10. The uvula rises and falls with phonation, or rises together with phonation. If you will stick your tongue out, that's cranial nerve 12. Tongue is symmetric without fasciculations. So then I will assess the patient's neck. I'm going to look for symmetry. I'm going to palpate her esophagus to make sure it's midline. I'm then going to palpate for her thyroid, if you will swallow. Good. And then I will palpate her carotid artery for pulsation. And then I will listen for any throws. Good. Okay, and now I'll ask you to please turn around and I will assess your posterior chest. So here I'm looking for any signs of respiratory distress, accelerated muscle use, tripod positioning, nasal flaring, cyanosis, rapid breathing. Now I'm going to assess for symmetry with chest wall expansion, if you will breathe in and out. Good. And I'll palpate for tactile affirmatives. So when you feel my hand, please say 99.
99, 99, 99, 99, 99, 99.
Good. Now I will, I'm going to percuss your lung fields in the intercostal spaces. Good. Now I'm going to listen to all of her lung fields, avoiding the scapula area. Breathe in and out when you feel my stethoscope. Good. Now I'll test for edophony. If you'll please say E every time you feel my stethoscope.
E, 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 E.
All right, and then if you will please say 99, we'll test for bronchophony.
99, 99, 99, 99, 99, 99.
Now we will test for whisper periloquy. Please whisper 1, 2, 3 when you feel my stethoscope.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Good. Now I will ask you to turn around and I'll assess your anterior chest. We are looking for the same thing. I'm looking for symmetry. I'm going to palpate for chest wall expansion. You breathe in and out. Great. And then I will palpate for tactile affirmatives. If you will please say 99 when you put my hand.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Now I'm going to listen to our lung sounds on the side as well. Starting above the clavicle. In and out. Thank you. And then I'll make sure I'm listening on her sides as well. Alright, now I'm going to listen to her heart sounds in all 5 locations with the belt and the diaphragm. Starting with the diaphragm, we've got aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to palpate for the point of maximal impulse. In that area, I would listen for a full minute, and I would report the rate and rhythm. At this point, I will ask the patient to please lie on the couch at a 45-degree angle. So with her head tilted, I'm going to look for any JVD and jugular vein pulsation. And then she can relax her head. And I'm going to look at her chest with her lying flat. I'm looking for any heaves or lifts in the areas that I will be listening to. I'm also going to palpate each location point, aortic, pulmonic, Erb's point, tricuspid, and mitral for any thrill. And then I'm going to listen again to all 5 locations with the bell and diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to assess the contour of the patient's abdomen, looking for symmetry, contour. I'm going to listen to her arteries with the aortic, iliac, renal, and femoral arteries. Aorta, iliac, renal, and femoral. Now we're going to listen to all 4 quadrants of the patient's stomach. Good. Now I'm going to percuss the patient's abdomen for any tympany, flatness, or dullness. Okay, and now I'm going to palpate for any tenderness or masses. So if you're feeling tenderness, please let me know.
No. No.
Okay. Now I'm going to palpate for the patient's liver and spleen. Okay, and all right. Now I'm going to ask you to sit up for me, and if you'll just face that direction, I'm going to percuss for CVA tenderness. If you'll tell me if it starts, please.
No. No.
Good. All right, now I'm going to assess her upper extremities. Starting with looking at her skin, I'm looking for overall elasticity, warmth, and moisture. Looking for any edema, if there's no edema. So I'm going to palpate her radial pulses, and I'm going to do her capillary refills. Then I'm going to feel the joints of her fingers, wrists bilaterally, elbows, and her shoulders. I'm looking for any swelling, deformities, crepitus, or tenderness. I'll then do the range of motion of her hands. If you will, just flex your fingers down, extend them up, abduct them out, adduct them in. Then we'll do, there's no hyper extension, so we'll do her wrist. We'll do flexion down, extension up, abduction out, abduction in, and then rotation. All right, and there's no hyperextension there either, right? Good. All right, so then we'll do her elbows. So we'll do extension, and then, flexion, and then extension out. Any hyperextension, just have some. All right, so then we'll do your shoulders. So we'll do abduction, which is out. If you'll flex them outwards, good. Abduction is to bring them in, good. And then we'll do flexion up, good. And then extension back, and then there's no hyperextension for her either. All right, so now we'll do bilateral hand grip strength. So I'm going to put my fingers here. If you'll squeeze, good, 5 out of 5 strength. Then we'll test the strength of her triceps and biceps. If you will, push up towards me. And then put your hands like this. And then try to go down towards me and up towards me. Good. And then we'll do shoulder strength. So we'll do abduction first. So I'm putting my hands right here, and she will try to go out against me, good. And then abduction, go down. Good. And then we'll do strength of the shoulder girdle, if you will, just try to shrug against me. Good. All right. Now we're going to test the deep tendon reflexes, starting with the brachial radialis. We'll do the biceps. Good, and we'll do her triceps. Good, and then we'll do her patellar reflexes. And then we'll do her Achilles. Good. And then we'll do her Babinski. If you'll just hold your feet up, please. Good. Good. Now we're going to test for light touch sensation on the upper and lower extremities. If you will close your eyes, and when I touch you, tell me that you feel it.
There, 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 there.
Good. All right. Now we're going to assess her lower extremities, looking at her skin, overall elasticity, overall no edema. So I'm going to feel her posterior tibial pulses and her dorsalis pedis pulses. I'm going to do her capillary refill. I'm going to go ahead and palpate her joints of her toes, of her ankles, of bilateral knees, and hips bilaterally. Same thing as before, I'm looking for any deformity, swelling, tenderness, or crepitus. Now I'm going to do the range of motion of her toes. If you will, flex them down towards your toes, down towards the floor, and then extend them up towards the sky. Abduct them out, adduct them in. Good. There's no hyperextension with her toes. We'll do your ankles. If you'll do flexion down, and then plantar flexion up, and then we'll do inversion, eversion, and rotation. Good. And then we'll test the strength of her feet, of her ankles, and her knees, and her hips while she's here. So we'll do dorsiflexion. If you'll just go forward, thank you, and then press against my hands for plantar flexion. Good. And then we'll do knees. If you will, try to extend against me. Good. And then flex against me. Good. And then we'll do her hips. I'm going to have her try to spread her legs, abduction against my hands on both sides. Good. And then in. Good. 5 out of 5 strength throughout. So then I'm going to have her stand up. And we'll do her knee movement. We're going to do flexion, extension, and then we'll do the other knee for flexion and extension. Good. And then we'll do your hips. We'll do abduction in, or out, abduction in. Other leg will do that. And then we'll do external rotation on each side. And then circumference. Just good. All right, so now we're going to have you lean forward. And I'll feel the curvature of her spine. There's no scoliosis or tenderness. I'll have her do flexion of her spine forward, and then extension backwards, and then lateral flexion side to side, and then rotation around. Good. And then I'll have you close your eyes with your hands by your side for a Romberg test. Good. And then I'll have you walk normally. And then back. Good. And then we'll have you do tandem walking, which is toes to heel. Good. All right. And that completes our head to toe assessment.